certain people avoid marijuana? Of course, like alcohol, marijuana poses certain risks and is not for everyone. Consuming cannabis will alter mood, influence emotions, and temporarily alter perception, so users should always pay particular attention to their set emotional state and setting environment prior to using it. The drug should not be taken prior to driving or prior to engaging in tasks that require certain learning skills, such as the retention of new information. In other words, don't consume marijuana before attending class or taking an exam. Adolescents should also be advised to avoid cannabis, as it remains unclear whether marijuana, like alcohol, adversely affects the developing brain. Pregnant women should also avoid cannabis, just as they should avoid consuming tobacco or booze. Men trying to start a family may also wish to refrain from marijuana, as heavy use has been shown to lower sperm count and motility in preclinical, though not human, trials. Because inhaling smoke over long periods of time is typically associated with increased incidences of cough, wheezing, and bronchitis, inhaling cannabis or any substance ought to be avoided by people suffering from various breathing-related issues such as chronic obstructive pulmonary disease, also known as COPD. However, unlike tobacco smoke, cannabis smoke acts as a bronchodilator, which is why it is sometimes used by those with asthma without ill effects. Consuming cannabis can also temporarily increase heart rate and likely should not be advised for people suffering from high blood pressure or a history of heart disease. There is also data indicating that patients suffering from severe liver problems should avoid using marijuana regularly, as some studies have identified a positive association between daily pot use and the progression of liver fibrosis, excessive tissue buildup, and steatosis, more commonly known as fatty liver disease, in select patients with hepatitis C. Other studies have reported that cannabis may be helpful for those with the disease. Adults who suffer from so-called addictive personality disorders may wish to avoid marijuana, as they may possess greater tendencies to become dependent upon the drug. That said, as we discuss in detail in Chapter 5, far more people statistically become dependent on booze than ever exhibit symptoms of drug dependence from pot. Finally, there's evidence, though not conclusive, indicating that people suffering from mental illness such as psychosis, depression, or schizophrenia, or who have a family history of mental illnesses, should avoid cannabis. To date, a handful of studies have identified an association, albeit a minor one, between chronic cannabis use and increased symptoms of mental illness. Other studies have failed to find such a link. However, interpretation of this data is troublesome. First, people with certain mental illnesses, such as schizophrenia, tend to use all intoxicants in greater percentages than the general public. Second, confounding factors such as poverty, family history, and polydrug use make it difficult, if not impossible, for researchers to adequately determine whether any cause and effect relationship exists between cannabis use and mental illness. Notably, there is no available evidence indicating that cultures whose populations engage in the widespread use of marijuana suffer greater incidences of mental illness compared to populations that rarely use it. Consequently, many experts believe that pot's alleged association with mental illness, if there truly is one, may be due to patients self-medicating with cannabis. Survey data and anecdotal reports of individuals finding therapeutic relief from both clinical depression and schizotypal behavior are common within medical lore, and clinical testing on the use of cannabinoids to treat certain symptoms of mental illness has been recommended. That said, we still believe that individuals who may be predisposed to such conditions should exercise caution before engaging in the use of cannabis.